I'm Karolina Mackiewicz. I'm the Innovation Director at ECH Alliance, and I will be here today to moderate some sessions, but I will also be here today to meet you and discuss how we can work together, for example, around projects, EU-funded projects or projects funded from the other sources. And now I think we're ready for our first session. When you look at the program, our topic for the whole day is the digital health at scale, how innovation, how financing, procuring shapes the future of digital health. And we were thinking there is no better way to start this discussion from highlighting the example from the country of Estonia. I know you've heard about the Estonian example a lot before. We would like to have a short keynote presentation from our colleague, Ain Avikso, who is here with us from Heba Clinic, accompanied by the commentary from Marilyn Versama from the Technopole Health Tech community. So please help me welcome them to the stage. And I will pass to Ain to give us a bit of overview of the history of digital health. How did it happen that actually Estonia became the example, became the role model? And after that, we will hear from Marilyn how we are looking into the future, what is there for all of us to know, and what is there to get inspired. Ain?
Thank you. Well, no pressure here. I know that great presentations are going to come later on today, but I'm also happy that I can share today the stage with Marilyn. You're going to hear about it in a while. I have already gray hair. My understanding of the world comes from the last century, and the things happening around us these days at minimum are bizarre. But I try to survive, and I still am proud of the tiny country of Estonia, 1.3 million people, that we have achieved, and that we can still be part of a larger journey that ECH Alliance is most certainly, for us, so to say, instrumental, so that these connects that will be, the dots that will be connected do get something from our experience as well as nurture our journey forward. I'm recent times very bad at doing slides, so I decided that I would do just one, because if I would have tried to split it into many, I could have stuck just on the second one, because I want to tell you a story, and I will tell the story by wise words that I heard once from it was an Estonian general talking to a large group of Estonian civil servants, business leaders, and it was about how to build a resilient strategy for a society. And then he asked from the audience, do you know how any good strategy runs? What's the most important thing? It runs from left to right. So that's something that I learned, and this is also, please, so from left to right. So when you are seeing, nice things about Estonia and all, things that I have done, usually are somewhere here. But you can't get here if you don't start it in the beginning. And, last century, in the end of that, we had a health insurance fund, which was then consolidated into one, and they thought that, okay, it's tedious work to do all this billing and invoicing on paper. So first, they gave opportunity to send invoices from the providers in digital form. But it was around 2000 when there was no law passed by the government. So Health Insurance Fund in Estonia, you should know, is a independent authority. It's established by the law, but they are in contractual relationship with the providers. So that it wasn't mandated by the minister, just Health Insurance Fund told to the providers. So if you send your invoices to us on paper, you still get paid, as usual, in 6-7 months, because we need to check that you're not cheating. If you send us them digitally, we promise we pay you in 2 weeks' time. Guess what? How long did it take? All the providers sending in their reimbursement claims digitally. It was half a year, more or less of a year. So that was something which laid the groundwork for starting operating digitally, because that meant that at least the financial data was already in hospitals digitally. You also know that one of the biggest problems these days with EMRs, they are accounting systems with some clinical information attached to that. So that was then the push that was made by the government. And thank you, European Union and the European Union taxpayers. There was this EU money available, and the wise people decided that we need to do at least 4 things. We need to have national health information system where all the information will be shared across primary care, hospitals, private providers, and public providers. This was then mandated by the law. The infrastructure was built with the help of EU money. And then another interesting thing was prescription. Prescription is a service that everybody has these days digitally. But the workflow is very simple, but it runs through the whole system. It touches upon all the citizens and almost all doctors in one point or another are related to that. So you didn't need to change the workflows, but everybody was somehow related to the system. So in my mind, these 2 things in the beginning, in the first strategy, were the most important bits. The National Image Archive still remains as it is, and that's maybe good for another story. And national e-booking, you see, is with a different color. And here I ask you to run through all the way to 2020, 2019, because it eventually got implemented more than 10 years later. So that you may have a strategy, not everything plays out as intended, but you will get there if there is sufficient will. And I will come back to that just in a minute. So the first strategy, yellow area here, tells that we had National Health Information System, which connected all the providers. We have e-prescription, which connected all the individual entities and agents in the system, including patients. And then we have some additional activities done to that. Now, if you look at the bottom of the slide, you see there 4 different entities, and that is also part of the story. I already told about the National Health Insurance Fund, but another key player in its own time was eHealth Foundation. So, again, in Estonia, providers are by law independent, legally independent entities. They decide who they will hire, which buildings they build, and also what software they use for their operations. And that's kind of another legacy from the 90s, when Estonia was the poster boy for the World Bank to do healthcare reform, so that we actually were able to reduce the number of hospital beds, because it would have not been possible for the politicians to go and say, we will shut this one, we will shut this one down. It was all given to the hospital managers, who merged, and then naturally the efficiency allowed them to do the things they wanted to. But it also gave us the legacy that each hospital had their own electronic medical record. Remember, 1.3 million people, roughly 50 hospitals, and by today we have 4, but at that time we had maybe 7, 8 hospital medical information systems, far too many. So what the government did as part of the strategy is that they actually formed a consortium. It didn't have kind of legal formation, but only the management bit had. But in the board there were sitting large hospitals, hospital association, family medicine association, but then also members from the health insurance fund and from the government. And they made strategic decisions which other strategic development projects will be implemented with the EU taxpayers' money, with the Estonian taxpayers' money, seconded with the supporting development work by each hospital or family medicine organizations. So, and that gave us some e-consultation, that gave us national health statistics from secondary data, and that also gave us the good starting point, starting building cross-border services between Estonia and other countries. And then in 2015, the next strategy started. Yes, thanks. That's what I thought. The next period started, and I will not go into individual details, but the message from those green accomplishments is that the second stage of the strategy in Estonia was building on top of this, the groundwork that was laid during the first period, meaning that we could start building solutions like digital workflows across healthcare system and social care. We could build digital workflows. It sounds maybe odd, death certificate, but death certificate is not just a document. It links to each individual municipality, which then follows up with their administrative tasks. It links activities from primary care or then to the hospital, and then also the statistical National Statistics Board needs to do the census data update on that. So it enables us to start connecting not only healthcare organizations, but health system with social system, with other ministries and departments. And then also around 2019, we were among the first to build the e-prescription system across borders. I think the first one was between Estonia and Finland, and now this has become kind of tradition for everyone. And I will finish now by coming back to the national e-booking that was part of the first strategy, but what was initially implemented together with e-booking and e-referral, so that the time matured that it is not just replacing one paper with a digital component, but it actually encompassed then also additional information that the family doctor would send to the professional. And just a few years later, actually it was expanded, which has now become a standard, so that this dumb referral, the patient comes to the family doctor and the family doctor just sends a note to the specialist, has now become an e-consultation, which means that it's not the patient that travels from one city to another to the specialist, it is the information that travels, and it actually opened up a new way of organizing services. If we would have implemented our national e-booking as we did maybe 10 years ago, it would have been certainly more difficult to change those workflows later on. So that I will finish up with this red arrow on the edge of this right-hand side, telling that Marilyn will tell us what happens now after we have reached, the world as we know it today. We started working together with Marilyn in 2015, I believe. So I'm happy, pretty much as Brian mentioned, to hand over the baton to people who know the digital world like natively. They have lived with that. I still translate the old kind of analog world to the digital. But yes, if you start from the left, you always get to the right. And this is what I hope anyone will do in their own way, in their own pace. And I hope that we can contribute, at least in a tiny bit, also in the future. Thank you.
Thank you so much, Ain, for the introduction and the quick overview of how did it happen that Estonia came to where it is now. And you said there is a red arrow that Marilyn will open. What does it mean? I think you have also a new digital health strategy in Estonia now. So tell us, Marilyn, what is happening right now and where we are looking into the future and how Estonia will further inspire us and be our role model for digital health innovations.
Yeah, thank you so much for inviting, and thank you, Ain, for the overview. What I wanted to add as well was we don't have the slide in the back anymore, but this is actually the journey how Estonian public health services are 99% digitalized. So easy access to your healthcare professionals, e-consultations, e-prescriptions, so everything flows through data sharing, which is actually very convenient, provides support also in remote areas, and provides faster access for healthcare services. And I think last year we also announced our second version of Estonian Health Information System, which actually provides better usability, provides better overview for the patients, but also for the healthcare professionals. So I think for the next steps, we're currently in the middle of implementing a new Estonian e-health strategy, and there are three main pillars in that sense. So the first one is actually sharing quality data, and I think the data is also the new tiger lip, like we like to say in Estonia. So if we have quality data, we have the ability to better detect health outcomes, better to provide treatments, but also preventive activities. So this data-driven approach is definitely one way. The second one is actually how to support healthcare professionals in improving their digital capability. So we know that the technology is advancing very fast, but we also need to provide training programs for the existing clinicians, because if you have an application or a solution and you don't know how to use it, it's useless. So you just spend countless hours and funds if you don't know how to actually use it. So, and what we're actually also facing now is the challenge regarding healthcare professionals. So the population is aging. In Estonia, the average family doctor is 57 years old. We need to face that. So we need to actually support the professionals because if they document all the data, it takes so much time. So just better provide efficiency in that sense. And the third part is actually providing human-centric services to give also the power to the patients, also notifications, reminders, do regular health checkups. So this is also the three pillars that we're talking about.
So we said data, skilling, reskilling, upskilling the healthcare professionals, training programs, and then human-centric services. Recently, I was also thinking about the issue of the healthcare professionals, how to support them. I was thinking that perhaps we can compare it to the car mechanics. So we're learning how to treat the diesel or petrol engines, and now they have to, like with e-cars, they need to become a bit more like engineers. And I think this is also happening with our healthcare professionals. So how you, that we actually have to give them new skills, new knowledge. They have to understand how the data flows, what is the benefit of the data. So do you have any concrete examples of how to help them in this journey, how to make sure that the technology is not disturbing their job, but is supporting, and how you also plan to finance all those changes and improvements?
Yeah, I think it's all about this change management system. You can use different models like this ATCAR model also in the hospital settings to actually try, use and implement these new kind of solutions, but it doesn't happen actually overnight. So I think Ain can also give great examples how some departments in hospitals actually work great because they have someone who leads and supports them in implementation, but there needs to be like a support regarding whole organization. Okay. So
the great kind of change has been first that this time the government in the strategy explicitly said, okay, these are the areas that the government will take responsibility for, and these are the areas where we expect that the innovators will come and bring us the solutions. So that in the previous period there was some friction, and I've been part of some of the projects which didn't go any further because nobody didn't know whether the government will actually step in eventually, and then all your nice solutions will be just disregarded because everyone has the mandate to use the government solution. So this time, again, this is possible because the system from the start has been built in such a way that you can contribute either from the public or the private sector. And with the professionals, it is, as I say, the doctors need to live together with this new thinking machine to let go some of the, if you will, authority of knowledge, because the computer will always know more and better, but not to lose the empathy, the ability then to tell to the person that, well, computer said, that this is the thing, but doctor, what should I do? And this is probably still will be with the doctors. It will not go to the computers.
Thank you so much. So just to finish this short conversation, what would be your message to the innovators here in the room that also want to improve the situation in their countries? What's a very short message from both of you, how they can influence the digital health strategies in their own region, country, city, learning from Estonia?
Yeah, I mean, we have quite a lot of delegations coming around the world asking how we do it. So, you can't just create digital health information systems. You have to have the whole infrastructure being built on data. I think this previous question, this year, our president actually announced that since 1st of September, we will have an educational program to support high school students and teachers. So more than 20,000 students in high schools will start to use different AI programs, AI solutions, and the government will actually fund every year 6.5 million euros for that. So we have to start from the ground because, if you study to be as a medical professional, you need to have also this education on how to use new technologies, but we also need to change the mindset because I've been also talking in different hospitals and there's quite a huge fear that the technology actually takes over their medical skills. So we need to change that mindset and support them because technology is an alternative that actually supports your work and provides better efficiency.
Perfect. Thank you so much. This is message from this morning session about Estonia being our role model. So thank you, Marilyn. Thank you, Ain, for joining us today and giving us this boost of energy for the day. Thank you so much.
Thank you.
Thank you so much.